seated as our guests will arrive shortly. Ladies and gentlemen, please rise and put our hands together to welcome our guest of honor, Tan Sri Datuk Sri Dr. Nohisham bin Abdullah, Director General of Health Malaysia, accompanied by Datuk Sri Dr. Anwar Fazal and Datuk Dr. Wu LienTeh. Tan Sri, please be seated. A very good afternoon, salam sejahtera and salam sihat Malaysia. Yang berbahagia, Tan Sri Datuk Sri Dr. Nohisham bin Abdullah, Director General of Health Malaysia. Yang berbahagia, Datuk Sri Dr. Anwar Fazal, President of the Dr. Wu LienTeh Society. Yang berbahagia, Datuk Dr. Wu LienTeh, Executive Director of Penang Institute. Datuk, ladies and gentlemen, both in the hall and joining us virtually from the online platform. Welcome to today's event. On behalf of the organizer, we wish to extend our warmest welcome for you to attend today's 6th Dr. Wu LienTeh Annual Public Lecture and the inaugural ceremony of the Dr. Wu LienTeh Award for Leadership in Public Health. I am Ho Chi Ping, Secretary General of the Dr. Wu LienTeh Society and your MC today. Today's event is held in conjunction to commemorate the 143th birthday anniversary of Dr. Wu, which falls on 10th of March each year, and to celebrate his legacy with everyone here. It is also part of the serial event for our 10-year anniversary of the Dr. Wu LienTeh Society, which established back in 2012. Without further ado, let's put our hands together to invite Yang Berbahagia Datuk Dr. Wu LienTeh, Executive Director of Penang Institute and co-chair of today's events, to the stage.
Thank you, everyone. Tan Sri Datuk Sri Dr. Nohisham bin Abdullah, Dr. Sri Anwar Fazal, dear members of the Dr. Wu LienTeh Society, ladies and gentlemen, friends. We have all been going through COVID-19 for so long, I am beginning to forget what it was like before the pandemic. Were things really that simple before 2020? I don't quite remember. Could I really just buy a flight and go wherever in the world I wanted? Was I actually able to go anywhere without my handphone and not feel totally stressed out? Go anywhere without my handphone and feel totally stressed out? Did I happily jump into crowded elevators and feel fortunate that there was just enough space left for me to squeeze into? All that have become issues for us, of course. But the fact that we are holding this annual conference today is a good sign, a very good sign. There's optimism in the air, and we have, all of us individually, learned some hard lessons from the pandemic. With that background, what an honor it is for us to have Tan Sri Dr. Nohisham bin Abdullah with us here today. When COVID hit Malaysia, we were all rather dazed by it. We didn't know what to expect, and we hoped that it would have a limited impact on the country. I remember, personally, the sense of assurance back in early 2020 that Tan Sri Datuk Sri Dr. Nohisham Abdullah exuded during his public appearances, the comfort that all of us really needed at that time. This man knew what he was talking about, and he did not waver. Finally, a reliable technocrat and not a bumbling politician, I thought, telling us what to do and what to expect. Penang Institute, along with the Dr. Wu LienTeh Society, is very happy, therefore, to have Tan Sri Nohisham's presence here with us today to speak to us at this annual conference held in honor of Dr. Wu LienTeh, one of the illustrious sons of Penang. COVID drew positive attention to Penang, thanks to a man who was born here 143 years ago and who died 62 years ago. We are all proud of Dr. Wu LienTeh, not only because of the millions of lives he saved, but also because the methods he used to fight the pneumonic plague in Manchuria became standard procedures even during COVID. With COVID, what the relevance of this man did has become even greater. Penang Institute is proud to have been a founding member of the Dr. Wu LienTeh Society and remain its secretariat today. Outside in Penang Institute's garden stands today a huge bust of him in bronze, gifted to the people of Penang by the first affiliated hospital of Harbin University. This was in March 2014. Around that bust, we have now built the Wu LienTeh Herb Garden, which was launched on the 11th of March last year by Chief Minister Chow Kon Yeow. And Penang Institute is further honoring Dr. Wu LienTeh, the plague fighter, by renaming one of our meeting rooms the Wu LienTeh Commemorative Study, upstairs, a small room upstairs. So congratulations to the Society for holding this conference. And thank you again to Tan Sri for gracing this occasion. And I look forward to many more such events at Penang Institute in the future. Thank you.
Thank you so much, Dato, for the optimism and the very warm welcoming. We would like next to invite none others but our beloved President of the Dr. Wu LienTeh Society, Dato Sri Dr. Anwar Fazal, to officiate today's event. Dato Sri.
Thank you, Dr. Peng. Dr. Peng has been an anchor of the society. As someone who, when he approached me, I said, what is this 18-year-old guy wanting to do with us, But he became just an amazing, both a physician where he is working and also someone who worked really full-time, in addition to a full-time job, for making this society what it is today. Thank you, Dr. Peng. Tan Sri, Dr. Nohisham, our distinguished speaker and our awardee, Dr. Wu LienTeh, Director of the Penang Institute, and a prolific writer, and a prolific, serious writer, someone whose books I enjoy always reading. Madam Lim, where is she? Madam Lim? Madam Lim, wonderful to have you here. An artist extraordinaire, who just someone who we didn't know, on her own inspiration at one of those moments that sometimes you have, just said she has to do something about Wu LienTeh to show you how his life and his inspiration touches ordinary people in different kinds of areas. Welcome also to this very special place. It's quite rare that you find a meeting room where you can watch trees and hear birds and and watch flowers and so on. It's an institute that has an amazing local, national, and global legacy of thinking about issues, of sharing wisdom, and also of really taking initiatives that would make a difference to people's lives. Welcome also to this celebration of a global legacy, who is Wu LienTeh himself, who was, you can say, 10 years ago nearly forgotten, until we revived him. We revived him, and we were very, very grateful that the revival occurred actually as something that we had called the Penang Story, where someone called Salma Koo was organizing, and we decided to invite someone to speak about Wu LienTeh. And based on that particular conference and then a discussion with Penang Institute, we began this whole process of now doing something and creating a whole, platform for remembering his life and putting us in touch also with the family. And we're very pleased to have Miss Ellison here. Where's Miss Ellison? She's down here. We have a relative of Wu LienTeh also present here, together with a number of related people. So we have the blood, we have the blood with us also in this place. We have also, this is also a celebration of a very special person who is continuing this legacy. It's amazing when we took Tan Sri just now for a meal. Everywhere he went, people were saying, hero, hero, you know, and they wanted to take pictures with him. And this was the sports club. And I think he had to take about 20 different photographs, you know, of people showing you what kind of popular legacy, you know, of someone who ordinary people everywhere in the country felt like he was one of their heroes. And it's really amazing to see that. This was right down from the guards, you know, the receptionists, you know, to the restaurant, you know, and the restaurant was so happy to serve him with very special Penang food and healthy food. This place is also very, very special because it's as Dr. Ui mentioned, it's become a place where the Wu LienTeh Society has its home, yeah, where the bust of Dr. Wu LienTeh has here at home. And this kind of relationship, what I call a yin and yang relationship between a private society organization, the Wu LienTeh, and an institution to do things together, that kind of synchronism together, doing things that is like private-public partnerships, and in this way civil society together with a think tank, and doing great things. They provided a home for us. And Decoupling here was heading their Penang Monthly, I think a number of other things. She was the person who actually was in Harbin and saw the bust of Wu LienTeh there and told them, hey, this is such a lovely thing. We gave you Wu LienTeh. Can you give us a bust of him in return? And it's amazing, they decided that they would give the bust, and so this bust, which is a model of the one that was there at the University of Harbin, where they have a Wu LienTeh Institute, by the way, and a Wu LienTeh library and a museum also. So it's amazing how much he's recognized there. And Decoupling then arranged for that to come over here, and it had a short stay at the Penang Medical Center where our first office was, and then we moved it over here because the place became not suitable for it, and then we set up it in a very unusual setting, because we wanted a setting where it's just not a monument hanging far away that people watch. Yeah? We want a monument that actually people felt was with them. So we arranged for it to be at like a human height. You can take your pictures with him, like feel you can hug him, yeah, in the place. And we wanted a surrounding where people can sit down and chat and talk about. And we wanted to make it a garden where there will be herbal trees and even a walk that you can do where you can study herbal trees. Because one of the things that's not very well known is that Dr. Bu was also involved in traditional medicine, and he has a book associated with that, which is also available. We were thinking of reprinting it, but it's been reprinted in China already. Yeah? But maybe we might still, because traditional medicine is a very big thing also in Malaysia, and the ministry has a special unit for that. Many universities are also taking that up, and we had also the wonderful arrangement where Woon, who's the COO, yeah? And COOs normally have to be very cool. That's why they've got the word COO, you know, in front, because they are the ones who actually have to manage everything, you know, and all the, you could say, tough work of getting. And then she's our Assistant Secretary General. So we had this nice arrangement also where some of the key positions in our society were held by people from the Institute who volunteered to go beyond their own job here to do and help this voluntary organization. And every single event that we have had, she's been like the manager for us to making sure that things are done very well. I think unfortunately she's not able to come here today, but please do convey a very special thanks to her because she's one of those anchors for the society. And so thank you so much, Penang Institute, for all this, for this beautiful yin and yang fellowship, because many of you know the yin and yang is a symbol of balance and harmony. It's actually a scientific symbol. People don't know the fact that it's a scientific symbol. They just think it's man and woman or what, It's the shadow that is made by the sun on Mother Earth if you put a pole. And because of the moving of the two, sun and earth, this symbol comes up. So it's really a sign showing the link between the heavens and the earth. And so for us in organizations also, where you have different kinds, what's your private, public, and people partnerships, because this third group, private people, private, public, and people partnerships are possible with this kind of synchronous work. So we also have been an organization that amazingly during this whole 10 years has been a volunteer organizations. And all the team members have been giving their time as a volunteer. We've never had any staff. And it's just amazing how people, we created tours, one of our wonderful persons who's also a treasurer. I don't know whether he's an accountant by training or not, but I think he's an engineer by training, Clement. He organized what you call the poster exhibitions, all on their own, so voluntary. He organized a tour that you can actually do. Then we edited and we republished Wu LienTeh's books, all his books that were forgotten, and then redid them in editions together with, in partnership with Arika Books, one of the really outstanding local book publishers and printers, and also owned by the person who had the first lecture about Wu LienTeh, whose father was teaching in the free school. And so amazing kind of, you can say, like family relationships. And I think when you have a situation and a movement where there is a feeling of family, you really get amazing links. One of the wonderful things that we did is, right from the beginning, we said there is going to be no future for the work that Wu LienTeh is doing unless we invest in multipliers and accelerators. That is, we go to the younger people and begin already to share those thoughts with them. So thanks to Dr. Peng's initiative, who has a passion for research, we worked with the Institute of Clinical Research to give young researchers awards. So calling them also young researchers. And they feel most, it may be a poster competition, it may be a small article, but the legacy then remains with them and with their life at that age, and they will be the persons who will also continue to be inspired. We did MOU arrangements with University of Malaya for award of the best PhD person. Again, that kind of thing encourages people to do. We had a program with the United Nations Institute of Global Health. We have an MOU with them to do several things, and we have an MOU with the University of Harbin, with whom we have a very, very good relationship. We also have something so unusual, where those of you who have been to Madras Lane, there's the Wu School, and they have two buildings there. One building was declared open by Rabindranath Tagore, a great Nobel laureate of literature. The other one was declared open by Dr. Wu LienTeh, and who was the chairman of the. And Wu was part of the movement of Pan-Asianism. Don't forget your own heritage, your own country. And they two together came in, and we made a mural where both of them are together. They both met too. They met in Calcutta, and they were in touch with each other. It was a movement called Pan-Asianism, that is fighting against imperialism and colonialism and losing our own culture and our heritage. Because Wu LienTeh, and that is very often also forgotten, was not only the health activist, he was the anti-racial activist. He fought also for the abolition of opium, and he said, what kind of ridiculous government do we have in this country? You are British. In Britain, you don't allow opium. Here, you allow our country to be soaked by opium and destroyed by that. And he really fought. And because of that, they punished him literally, and investigated his clinic and found a bit of opium, which is medical opium. Based on that, took him to court and fined him. Can you imagine that? Best student in Cambridge, #1, every year, comes back here, cannot be a doctor. Only Europeans can be doctor. these ones will have to be medical assistant, medical, some kind of title before, So you went to the IMR, the medical research, became a great research and move on. So his fight was just not about health. The fight was also about the integrity of our human character, about the way in which we should work in society. So it's really wonderful. So today we're celebrating all that. We're celebrating all that, and we're celebrating the way in which we, in one of the greatest, you can say, challenges that the human world has had, and that's the challenge of COVID, where it impacted on everything. It impacted on economics, impacted social issues, mental issues, impacted on politics in many countries, and also a challenge to the medical profession. And he showed how very often the medical profession has not been given the attention it gets, and only when people get sick you think of a doctor, but actually the health profession is much more than that, and now they're moving to the wellness programs of healthy living and and preparation, and these kinds of overall things now are becoming part of the major health. So we have someone today who was part of this story, who actually dealt with this story in a form that was very, very inspiring, and also who has realized that we have to have this comprehensive approach of what the WHO calls health for all, that we do not forget this. We take the best of everything, private, public, and civic engagements, have a culture of total health giving for that. And we also honored because he will be an inspiration for the next generation too, and we're hoping to work together for particularly capacity building. And Ms. Lim, I don't know what inspired you, but you'll tell us, I hope, later to do a picture of Wu LienTeh, a beautiful painting which we will see. Thank you for this little thing sometimes, that it shows that people on the street are doing. So, thank you all so much. Join the society, celebrate our work. Look forward. Thank you. Bye. Assalamu alaikum.
Thank you, Dr. Sri. Today's event has a special session where our very own local artist, Madam Lim Guat Eng, whom acquainted to know about Dr. Wu LienTeh during this pandemic, with the widespread use of masks. She was touched, inspired by this previously unsung hero, and painted 2 paintings over this course of pandemic. Painting 1, Tribute to the Great Man of the Century, which took approximately 2 weeks, while the second one, The Savior of Mankind, took almost more than 1 month. And she kindly donated both paintings to the society, which will be housed in Penang Institute, our strong supporter and great partner of the society. Let's put our hands together to invite her to speak a few words. What led her to actually paint this great man?
Dato' Sri, Dr. Nohisham Abdullah, you are our hero. My friends are waiting to take photo with you. And believe that. Yeah. My pleasure. Dato' Sri, Dr. Ahmad Fazal, Dr. Winky Beng. Selamat petang, tuan-tuan dan puan-puan. 在座各位嘉宾们，大家午间好。 最重要的是平安吉祥。Today, I'm so touching. Actually, I'm so excited and touching that the society have found me and my drawing had come to the best place. I humbly dedicate this painting to the man I respect and worship. Thank you, Dr. Wu LienTeh, for the selfless sacrifices and contribution which have benefited mankind for generations. You never ask for rewards, even in death. You ask to be cremated with no intention of claiming even an inch of the earth. You were a beacon of hope for mankind. Wu LienTeh医生，你是全人类头上的一片天。谢谢 ，Thank you. Terima kasih.
Thank you very much, Madam Lim. Please remain on the stage. Next, we would like to invite Dr. Sri Anwar Fazal, accompany Tan Sri Dr. Nohisham and Dr. Wu to come on stage to unveil the two paintings together with Madam Lim. Later on, it's just only this clip. Just release, just a second, just together. Just. Okay. 1, 2, 3. These are the two great paintings, all painted by hands with modern technique in combination with the Chinese calligraphy methods. So next, we would like to present a certificate of appreciation and some souvenir from the society to Madam Lim Guat Eng by Dr. Sri Anwar Fazal. The souvenir consisted of the two books by the society. Yeah, sorry. Two books.
And we give you 2 more books.
Yeah, thank you so much, Madam Lim. You can please be seated while the VIP please remain on stage. Yeah, thank you, Madam Lim. Ladies and gentlemen, Dr. Wu LienTeh was a highly respected public health physician and an internationally acclaimed plague fighter. His unyielding passion for humanity and social justice extended beyond his role as a doctor. His extraordinary life story and heroic achievement have remained an inspiration and set the standard for generations to come. This year, we established the inaugural Dr. Wu LienTeh Award for Leadership in Public Health to recognize the exemplary leaders and their outstanding contribution to the field of public health. Their passion and determination in making a difference for humanity. Their fighting spirit is infectious, and their achievement continue to inspire others. We will invite the awardee to deliver the NIM annual public lecture every year. This year, in recognition of his prominent leadership as the Director General of Health for Ministry of Health Malaysia in leading the healthcare sector response in the COVID pandemic for the nation, his visionary partnership with the Drug for Neglected Disease Initiative, DNDI, has revolutionized new approach for affordable drug development to eliminate hepatitis C. His efforts in enhancing universal healthcare coverage to marginalized communities and bring personalized healthcare back to home through creative innovation and digital technology are remarkable. Today, we celebrate this award, to be presented by Datuk Sri Dr. Anwar Fazal to Yang Berbahagia Tan Sri Datuk Sri Dr. Nohisham bin Abdullah, our very own Director General of Health, Malaysia. Next, we would like to invite our committee member Thank you very much, ladies and gentlemen, in making the short session a success. Without further ado, let's put our hands together to welcome Tan Sri Datuk Sri Dr. Nohisham bin Abdullah, the awardee for the inaugural Dr. Wu LienTeh Award for Leadership in Public Health 2022 to deliver his lecture today. Dr. Nohisham Abdullah is a senior consultant surgeon in breast and endocrine surgery in Putrajaya Hospital and currently held the post of Director General of Health Malaysia since March 2013. Apart from his expertise in breast and endocrine cancer and published numerous papers and textbooks, he chairs multiple medical professional council and national technical committee and actively involved as a policy maker in global organizations such as WHO and the DNDi. He has been conferred numerous local and international awards, including the prestigious fellowship ad hominem of the Royal College of Surgeons of Edinburgh in 2018 for his contribution towards healthcare. In 2019, he was given the honor to deliver the distinguished Martin Algover Lecture at the 48th World Congress of Surgery in Krakow, Poland. His special interests lie in enhancing universal health coverage and bringing healthcare back to community. Tan Sri, the floor is yours.
Thank you, Dr. Teng. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon. Yang berbahagia Datuk Sri Anwar Fazal, President of Dr. Wu LienTeh Society, Datuk Dr. Ui Kibeng, Chief Executive of Dr. Wu LienTeh Society, ladies and gentlemen, and the family of the Wu LienTeh. First and foremost, I would like to take this opportunity to thank the organization and the society for inviting me here this afternoon. It is a privilege to be here, and hopefully I think it's important for us to share our experience and engagement with the public, and also more importantly to address some of the issues and challenges, to explain the issues and challenges and manage the expectation of public, so that we build public trust in the system. We have a robust health system in the country. I was trained as a surgeon, and many of you will be asking why as the surgeons is taking the leadership in the Ministry of Health. But when we talk about public health, surgery is a neglected component of public health. 30 to 40% of the global disease burden is surgical based. And most of you would have known Mike Ryan, the current WHO epidemiologist that briefs us every day. And he was trained as a trauma surgeon. And this is why I think surgeons are taking the leadership. And in many countries, surgeons are health ministers as well. And this is why we are championing global surgery to address some of the backlog cases and also the neglected component of public health, that is surgery. And this is important for us to come together as one. This pandemic is a crisis, and this crisis has given us the opportunity to learn and to continue to improve our healthcare system, and more so to make our healthcare system more robust in time to come for the next pandemic. And certainly, I think this lecture today, I would like to share where we were before, where we are now, and how are we going to move forward in time to come. So this experience, as I said, has a very valuable experience for us in this country to improve ourselves. And this crisis brought us together. And for us to move forward, every sector is a health sector. And we need the whole government and whole society approach to fight our common enemy, that is the COVID-19. Not against ourselves, but to fight against the COVID-19. So I would like to share the first slide. Now, is Malaysia prepared in terms to fight the pandemic COVID-19? We do have the past experience handling SARS, handling MERS-CoV, H1N1, and etc. But that was probably more than 10 years ago. That's valuable experience in public health that we adopt and have taught us and matured our system to handle. But those days, we do not have the digital technology in hand. And now, with this pandemic, it has taught us to work together as a team, public and private, coming together as one, have a same common enemy, and move forward using technology. And this technology has actually matured our healthcare system to be more robust. So in time to come, probably we will be ready much better than before in handling the pandemic. Even now, 2022, handling the Omicron surge certainly is much better than we did handling the Wuhan virus in 2020 and 2021. So next slide. Never in our wildest dream and also imagination that this virus will continue to haunt us for more than 2 years. And today, look into the system. Basically, more than 6 million people have died from this virus. And this is certainly a very challenging virus affecting the whole world, not only Malaysia, but I think more importantly is to see other countries, how they fare, and also compare in terms of how we prepare ourselves and respond to this virus. So we continue. We started in Wuhan. The virus started in Wuhan in 2019, and we know just a matter of time the virus will reach our shore. So in December 2019, we heard about this virus in Wuhan, the outbreak of this virus. So we prepared ourselves in January. And when in China released the genomic sequence of the virus, we prepared our lab to be able to detect this virus using the genomic sequence that had been released by China. And on the 25th of January, we received our first case. There is a tour group, 12 of them actually visited from China, from Wuhan, tourists visited Singapore, and 2 of them had fever and were retained in a Singapore hospital, but 8 of them continue to cross over to Johor Bahru. And from there on, and then subsequently, we were told by our counterparts in Singapore, the 2 cases, the grandfather and the father, is positive. And we managed to trace the cases and quarantine them, and that's the first phase of our COVID-19. And we have about 23 cases, the phase 1, whereby it is also involved, we learned about the Western Dam cruise. A few of the patients, people are infected, and from there, I think the infection starts to spread. So it's important that after the phase 1, there's what they call a calm before the storm. For 11 days, we do not have any cases being reported. That is from 14th of February until 26th of February. Thereafter, we were told by my counterpart that there's actually a case detected from Brunei calling me personally that actually that's one of the citizens came to Malaysia and there's a gathering in Sri Petaling Mosque which involved 15,000 people. And by the time we went down to the mosque, most of them have returned back to their own country and their own states. And this is the concern that we have because at that time, India and other countries, they do not have cases yet. But this group already gone back to their respective country. And we know that just a matter of time, there will be a surge of cases because from the gathering, participants comes from Perlis until Sabah, Tawau. So we discussed with the Prime Minister, and the new Prime Minister decided to have a short lockdown. Within a short period of time, from 18 March 2020, we locked down for 2 weeks and then extended for another 2 weeks. At that point of time, we do not know about this virus. All we know is that we do have our tool that is basically a public health and social measures. We do not have vaccine. We do not know what treatment to use, and even the testing is very limited. When we started, we only managed to do a RT-PCR 1,000 cases a day. That's the maximum. But now we can do more than 200,000 or 250,000. So we have enough lab to do the testing, RT-PCR, and also we adopted RTK antigen to do the testing. So it is actually a journey for the last 2 years. And this journey have given us the opportunity to learn, to work together as a team, and to collaborate, public-private, to enhance every sector, the hospital system, to look into our research, to look into our laboratories, and etc. So I think this is a very important milestone for us. Next slide. Now, this is the COVID-19 trend by WHO according to the region. We have 6 regions now. If you look into this slide, the Europe and America, they are already towards the downward trend. Recently now you see downward trend in terms of Omicron surge. But in Malaysia, for example, when we look into it, we comes under a Western Pacific region. This is the Western Pacific region. The cases are only in the beginning to surge, which means we are always behind UK and America, maybe 2 months lagging behind. So they already gone through the Omicron surge, but we are just beginning to see increase of the cases. Now, looking into COVID-19 trend in Asia, so the latest trend of COVID-19 infection shows increase since December 2021. So we have a surge before during the Delta surge, and Delta is more virulent than Omicron. Some say that Omicron is mild, but it is not true. Omicron is less severe than Delta. It's probably mild because we have been vaccinated. But for those not vaccinated and those vulnerable population, it is still deadly. So actually, that's where I think those unvaccinated, once they are infected, they can be admitted to the hospital to seek further treatment. So these are the trend that we see now. We are in at the moment, there's a surge in the cases. This is Malaysia. You can see the surge of the Omicron cases. And other Asian countries also, we see the trend is increasing in our region. But we hope that this will be stabilized in the next couple of weeks, and then before we see a downward trend. Now, the situation in Malaysia, the report, you can see the first wave, second wave, then and then the third wave after the election, Sabah, PRN Sabah, we saw a surge in the cases. And here the highest is actually the Delta variant. And Delta variant, the cases on the 24th of August 2021, the cases documented was 24,600 cases then. And high fatality, we have death and also high admission to hospital and utilization of the ICU beds. Then we managed to control using the public health measures and increasing our vaccination. And since December, we detected our first case of Omicron, and we continue to search. But despite having a peak of 33,000 recently, last couple of weeks, but the hospital admission and the ICU utilization and the death rate remains in control. Next slide is, if you look, here is the COVID-19 latest situation, that the active cases that you can actually find this the report every day By midnight, we'll update in terms of the information, the cases, daily cases. Majority of the cases now managed at home, and admission to PKRC is less. ICU utilization is 0.1%, 0.1%, and recovered, those recovered from isolated and recovered are very high. So this is a good sign that we show that we share the information daily with the public. So we are not hiding any information with the public. Next slide. And here is the R value, reproductive value, whereby at the moment is 1.04, and this was on the 10th of March. Today is 1.03. What it means is that if 100 people are infected, and then one cycle, another cycle, Omicron cycle incubation period is shorter as compared to Delta and the Wuhan virus earlier. So if it's shorter, but about 3 to 4 days, then they will infect another 100 people. If R0 is 1.0, 1.0, if you've got 100 cases, the next cycle also will be 100 cases. If you have R0 of 2.0, 100 people will infect one cycle, 200 people. 200 become 400, and etc. So we tried our best to bring down, using public health measures, vaccination, and all other tools to bring down the R0. The best is that if we can bring down to 0.5. If 0.5, you are 100 cases, the next infection only 50, and then the next infection 25. That means that you can control. At the moment, it's stable, about 1.0. So which means the virus is still in the community. So we must be careful. Apart from vaccination, put on the mask, physical distancing, continue to wash your hand, avoid crowded places, avoid confined spaces, and avoid talking close to each other. So now, this is the projection that we have. So when we go to war, there's actually a projection where we are, how are we going to fare in the war. So we look into the assumption that we have in terms of the Omicron virus, how they spread. So comparing 28th of February and 10th of March. Here you can see the line, the black line is the average cases. Then the column, each column is the daily cases. This is the date, the daily cases. And our prediction, basically to anticipate, if our R0 is 0.9, that means the cases will continue to go down. So this is the blue. The blue is good. So from the peak, and then you can see it's going down, going down, going down. But unfortunately, when the Omicron surged in December, then cases are going up. Now, this is the daily cases being detected, the column. But the red zone is that when the R0 is 1.6, meaning 100 people will infect 160 people, and you continue to increase. So if you follow this trajectory, you will go up higher. And it can, some have predicted, probably to document 50,000 to 70,000 cases a day. And you see Korea, 240,000 cases. Even Singapore, a small country, documented 27,000 cases. So we are still using our public health measures. We are still hanging on to about 30,000 cases. And now the R0 here, the red zone is 1.6. The beige color is 1.2. But now our R0 is 1.03. So we hope that it will sustain, and then this graph will continue to come down. It came down for a while, and then it surged up a bit. And this is where we were thinking, perhaps this is what we are worried about, because even Omicron, there is actually a mutation in Omicron, the serotype, BA1 and BA2. Probably we are seeing a BA1, then cases goes down, and then now surge again. That's another subtype of Omicron, still Omicron, but a BA2 Omicron surge. But what is more important, we hope that your plateau has stabilized before it comes down. So that is where we are at the moment, looking into the projection and the data. Next slide. Here you look into the new cases. The red line is the death, and then the green, those have recovered well, and the daily cases. So This is during the Omicron surge. You can see the daily death is very high, and then the recovery is low. But now you can see that after the vaccination and good coverage, the recovery is very high, daily cases high, recovery is also very high. And death are still within control. It's not that 2 figures daily. So that is something that we hope that we can blunt this and then flatten the curve for these daily cases. Next. And the new cases by clinical category, and majority of cases now that we see, because of the high vaccination rate, there is actually coverage now for adult population in Malaysia is about 99%, adolescents 91%, adult receiving booster for the whole country is 65%, and now we are moving, adolescents there's no booster, now we are going to the children age 5 to 11. So far, the first dose has been given, about 31%. So this is the group lagging behind that we need to increase the vaccination among the children. The infection rate among children is high now as compared to before. Before, because of the lockdown, the children are mainly at home. But today, the schools have reopened, infection rates is going up. So majority of cases, because of the vaccination, you can see that category 1 and 2. Category 1 means no symptom. You are infected, but you don't even know that you are infected. Category 2, you are mild cough, some symptoms that you have, but very, very mild. Category 3, you got lung infection, but you don't need oxygen. Category 4, you got lung infection, but you need oxygen. Category 5, you got lung infection, you need oxygen and ventilation. Yeah, then this category 5. So majority of cases, 99.5% in category 1 and 2. Because of the vaccination, it gives you the immunity. Plus, those who are infected, the recovery we showed to you, very high recovery rate, almost 3 million. So 3 million population already have some form of natural immunity after they recovered from the COVID-19 infection. So majority, category 1 and 2. So the question is, how many of this category 1 and 2 eventually deteriorate to category 3, for example, or deteriorate to category 4 and 5? So we use a proxy. Here, about 1.3%, looking into every week, those category 1 and 2 been admitted in PKRC. So that means they deteriorate to category 3 and then admitted to the PKRC, about 1.3%. Not high, still reasonable, well controlled. And category 4 and 5, only 0.5%, which means category 1 and 2, eventually they deteriorate to category 4 and 5. Namely, they are in the high-risk group, elderly, those who have diabetic, hypertension, and etc. So this group, despite vaccination, they are also at risk. So this is why that they need to comply to the public health measures. Next. Okay, then you look into COVID-19 active cases, monitoring trend. Majority of cases, category 1 and 2. Only the rate is the one that we look into category 3, 4, and 5. So it still looks like it's already been plateaued in that sense. So there's no increase in category 3, 4, and 5. That's why our hospital still have the capacity to accept patients to the ward, as well into ICU, and even for ventilation. Next. Here is the admission to the hospital by clinical categories. Now, not necessarily category 3 and 5 been admitted. Majority of cases, 62.4% category 1 and 2. Number 1, they are high risk, that's why they have been admitted to hospital. Number 2, because they went to the hospital for different reasons, maybe for surgery, maybe for treatment for diabetes or hypertension, and then when they tested, they are positive. So the category 1 and 2, 62%. And those infected category 3 and 5, 37.4%. So less than half of them, category 3, 4, and 5 needed admission in the hospital. And here you look into bed occupancy rate for ICU capacity. Now, total ICU beds available in the Ministry of Health is 1,600 beds. Current ICU beds been occupied for COVID and non-COVID about 60%. There's 948. And COVID ICU beds, meaning we reserve the beds only for COVID patients, 885. Utilization of ICU bed currently is 379, about 43%, which means we still have the capacity despite the peak of the infection of 33,000, more than 24,600 cases on the 24th of August. So which means we can see a decoupling effect now, because in the past for Delta variant, when the cases goes up, the admission also go up. And also the severity goes up, needs ICU and ventilation. But for Omicron, when the cases goes up, the admission and the ICU beds are still within control. So which means that is a good sign that because it shows that the vaccine works. If we do not have the vaccine, then I can rest assured, that the admission rate also will increase. So we fear now is that the pandemic have changed to the pandemic of the unvaccinated. Those who are not vaccinated, they are at risk for the infection. Here you look into the cases now. This is the ICU. There's utilization slightly increased, but still within control. Then this is the vaccination. This is the booster dose. And here the peak of the utilization of ICU beds, ward, and also PKRC. And you can see that it came down, and now there's a slight increase, but still within our control, within our capacity. What is more important now, we realize that the admission is much shorter as compared to Delta variant before. Those days, during the Delta variant, the admission, they have to hospitalize for 2 to 3 weeks, but now mainly 4 to 5 days. Next. Here, look at the data in terms of the death and the BID. So the cases are increasing during the peak of the cases last year, but now it came down and still within the control. Now, the COVID-19 death rate by epidemiology, you can see the cases in terms of case fatality. CFR is case fatality rate. So it's coming down from 2. It came down 0.1, and this is the overall is 0.92, but for Omicron is 0.19. So this is something that we see that even the death actually has decreased from the Omicron. Not only the behavior of the virus Omicron, but because of our preparation of the vaccination, that's actually had reduced the fatality rate. Next. Here is the death rate per 100,000 population according to the vaccination status. So these are the daily cases. Then here you see the unvaccinated. If you are unvaccinated, then high chance you get infected and admission, and as well as the death rate increases. So death rate increase if you are unvaccinated. Those have completed the vaccination, this is the blue. So death rate is actually not that high. And those who have a booster is very low. So this is important because this shows that if you are not vaccinated, then the chances of fatality is high. And here it shows that most of the fatality, BID, brought in death and inpatient comes from Sabah, for example. And here the daily COVID-19 mortality and vaccination rate by state. So every state we see that the vaccination rate goes up, the cases comes down. So vaccination rate goes up here first, and then the cases goes down. So what it tells us is that vaccination works and then protects us. Although, we realize that some people are still very skeptic about vaccination, but this is the key for us to move out of the COVID-19 pandemic. Next. Here is the decoupling effect. So when we have a peak during the August 2021, hospital admission is also increases. Here you can see very significant increase in hospital admission, utilization of ICU bed and death. But now with Omicron, we peak more than 33,000 in terms of hospital admission, death and utilization of ICU beds is well within control. So obviously there's a decoupling effect. So decoupling effect means that despite seeing increase in the daily new cases and hospital admission, vaccine shows effectiveness in protecting vulnerable population. And a small number of admission to ICU and death rate are compared to the Delta variant in August last year. So decoupling effect, the trend is expected to continue. So now if there's a decoupling effect, so we are more confident to open our border, to open all sectors. Here you can see the immunization coverage at the moment for the whole population. For the adult population, 97.6, today is 99%. For adolescents, about 91%. And here is the general population, is about 78 or 79%. And here is the booster dose, 64%. And the peak children still about 31% for first dose. And here again, about 31% now for children. So we hope that in next 4 weeks, we will increase the number of vaccinations for the children. And here the pediatric occupancy, what we are seeing now, because the children have not been vaccinated, fully vaccinated yet, only first dose, only 31%, that shows that admission rate now is 4 times increase for the children. And this is why it's important for us to vaccinate the children as soon as possible. Next slide. And here is the peak immunization coverage. So we see certain states, the vaccination rate for the children is still lagging behind. We hope that we can actually increase the vaccination rate among the children, school-going children, for example. Next. Now, certain states, for example, you look into Sabah, Kelantan, Terengganu, the vaccination rate for the booster dose for the children is still way below the expected level. So we hope that we can actually increase the activities, outreach program, opportunist vaccination, using the school and etc. To increase the percentage of the children and adolescents. Next. So Omicron in Malaysia. So if you look into it, the first case of Omicron was detected on the 2nd of December. And now, majority in January, 70 to 80% of the cases Omicron, and we still have the Delta. But now you can see this is the latest majority Omicron. Delta is about 10%. So in just a matter of time, the Omicron will replace Delta. In a way, it's good because Omicron is less severe compared to Delta. But for those unvaccinated and high-risk population, the Omicron is still dangerous. So that's the reason why we need to step up our vaccination among the children as well as to protect our population. Next. Here is the variant, COVID-19 variant distribution by state. So majority of states we have documented, detected Omicron variant. Next. And here, because we have opened up the education sector, the schools and etc., now 706 clusters detected from January to 5th of March, and 473 active clusters and well controlled, and 437, basically 61% or 62% of the cluster mainly coming from education sector. So this is why I think adolescents as well as children need to increase the vaccination rate so that we can protect them from getting infection. Next. So the preventive and control measures, the public health strategies that we have in place, number one, it's very important to break the chain of the infection. So if we know someone is positive, then we isolate the person. So hopefully that person does not infect others. So, and second strategy is reduce the morbidity and mortality, death fatality rate. Third is that to do so, you must strengthen the diagnostic capacity. So now we use RT-PCR. RT-PCR is very sensitive and they can detect the virus, but when the virus load is high, you can use RTK antigen. Virus load high means you can infect other people. So you can use RTK antigen. Now it's available self-testing RTK antigen. So you can use that to test yourself if you have symptoms and you're positive, isolate yourself. And improve our immunization coverage, particularly among the children now and also the adolescent. Improve the awareness and cultivating the new norm so that we practice public health and social measures. Increase and strengthen the mental health and the psychosocial support among those, particularly in B40 and etc. And use the digital healthcare transformation and automation to manage our patients, a large number of patients, large load of patients in our system. Here is the flattening our curve of the COVID-19. So these are some of our strategies put in place. Hopefully that we continuously using these strategies and not only treating the patient, but we need to look into the whole system in terms of the mental health, in terms of the economy, social, religious activities, and also how best to complement. Say, for example, if we were to advise someone to be isolated, there must be support, family support, for example, or even supplies of food and etc. So I think this is why we need to coordinate with other agencies to come in to help the Ministry of Health to contain and mitigate the situation. Next. So the country preparedness in moving into the endemic phase. Are we ready to move to the endemic phase? Initially, our aim was to achieve 0 cases, which we did in 2020 when we used public health and social measures only, no vaccine, and no treatment at that point of time. We managed to bring down in July, 14 July to 0 cases, only complying to public health. But how long can we comply using public health measures? Everyone stay at home, for example, less infection. We need to work, we need to move into society, then the infection will come in. So I think this is the compromise that we look into to move forward, and then we started the vaccination. So vaccination gives us the internal protection. Social measures and public health measures give us the external protection. So with this combination, we believe that it is time for us to move forward. And now with the testing, TRIS, for example, test, and then report, and then isolate, and then inform, and then seek treatment. So you can actually use MySejahtera, for example, to key in all the information. So, and we have the medicine now. If you are infected, you are elderly, not vaccinated, you are infected, we have the Paxlovid, for example, is the oral treatment and 89% efficiency in terms of stopping you from deteriorating to the advanced stage or stage category 4 and 5. So we will have this medicine in time, end of the month. We also have Monopiravir, and we have other medicine now available as compared to year 2020 and 2021. We do not have the medicine in hand. So because of this, I think we are ready to move forward in time to come. On 1st of April, we are going to open up our border. So for economy, for tourism, and etc. So there's a fear that when we open up our border, there will be more infection. Actually, the infection is already in our community. Every day, for example, if you have 30,000, 29,500 are mainly coming from the local community. 500 cases probably from overseas. But we make sure that we detect them. That means, although they come back, tourists come from overseas, 48 hours before departure, they have already done the testing. On arrival, they have another testing. So at least we can detect if they are positive on arrival. Next. Here is the 7 component in preparing Malaysia into the endemic phase, meaning we have to live with the virus. Number 1, we still have to comply to the SOP as recommended. And number 2 is that heightened alert. That means we continue to monitor the situation of the virus, what kind of virus, where about is the peak of the cases, and etc. So by monitoring now, we can control certain areas. So this will be the heightened alert system. And we also look into our capacity of hospital, whether our hospital in that area, in Penang, for example, whether there's enough beds, enough ICUs, with enough ventilators to cope if there's actually a spike of cases. Then testing, so we encourage now to do the testing, professional, RT-PCR, RTK antigen. You can buy it from the pharmacy, for example, less than 5 ringgit. So I think we encourage testing. If you suspect that you got symptoms, if you're going to have a public gathering, family gathering, probably it's good practice to test yourself first and before you attend any gathering. And self-empowerment. So we would like to public to take full responsibility on themselves. Health is not only the responsibility of the Ministry of Health, but it's actually individual. Each and every one of us must look into empowering themselves, especially looking into cleanliness. You know, you take care of yourself. You make sure that you put on the mask because the virus spreads, from the airborne, so you can get infected. So if you look after yourself, this is the best way to complement. But Ministry of Health will monitor. If you are ill, we will continue to treat you. And we are using a lot of digitalization, automated find, test, trace, isolate, and support using MySejahtera. So that also gives us in terms of the monitoring. And more importantly is that we safely open up our border, our economy, our tourism industry, and etc. So, and last but not least, community empowerment, which means you take care of yourself, you take care of the family, you take care of your community. So if you do that, then probably your community will be safe, your family will be safe, and you also will be safe. So I think that's the empowerment, taking responsibility in terms of cleanliness, in terms of compliance to the SOP, and etc. Next. Here is the SOP, only one SOP with 9 recommendations. And this actually have gone through the processes in terms of to get approval. So before, so many SOP that we get confused, but now we try to simplify the SOP, easy for the public to follow. Next. Here is some of the 7 SOP that very important for us to do. Number 1, QR code. That means once you go to any place, you QR code. And you can in the public places, on your tracker, your Bluetooth, so that if someone is positive in the same place with you, then you'll be nudged that you'll be careful because you're in the same place with a positive patient. That's one. Second is that if there's an outbreak, we know who to trace. We know where you were before, and then that will give you a warning system. Then you can take care of yourself. Then mask. Mask is the single most important public health measures because this is airborne. So it's the virus may be in the air. Putting on the mask can filter the virus. And what kind of mask? I mean, any kind of mask is better than no mask. What kind of mask? The best will be N95. If you cannot get N95, KF94 also is good. But if it's simple mask, then probably you can use fabric mask. Then you have to use double layer. So double layer will give you about 85% of protection. So mask is a must. And many other countries are not doing it, but we do not want to take that risk. We think that, mask is still, we have to continue, open up slowly, and before we remove the mask. And obviously, optimization in terms of physical distancing, if possible. Sometimes in the bus, in the public transport, in the plane, difficult to have 1 meter, but as much as possible, we stay a distance. Then make sure that you got good ventilation. If you look into the old buildings, old hospital, very good ventilation. But now I think some are very confined space. That's where the virus can spread. We also realize that the virus spread in the hospital, mainly not in the ward, but in the pantry. When the healthcare workers go to the pantry, open up the mask, and then they eat their meals, and that's where they come together, and that's where the infections start to spread. And vaccination coverage, as I said, this is another tool that we have to increase the coverage of vaccination among our population, especially the children. But under 5, we do not have the vaccine yet. There's no evidence to show the vaccine is effective under 5. But 5 to 11, we do have 2 vaccines been approved by NPRA, namely the Pfizer as well as a Sinovac. So 5 to 11, although majority of the children, when they get infected, they will recover, but there is a certain group of children, they will deteriorate because of MIS-C, multi-system inflammatory syndrome in children. So this is, so far we have 174 cases, children been infected and have the MIS-C. And this MIS-C have led to 7 deaths among the children. And this is also when the children get infected, they have symptoms like diarrhea and etc. And most important, I think, to take care of hand washing and cleanliness. So if we can have a good attitude in terms of hygiene practice, that would be the way forward. And this is a national COVID-19 testing strategy. When do you test? So if you have a public gathering, and this is a recommendation that we have in place, then you can refer to when to do the testing at home, and so that you are protected and you're protecting your family, especially if you want to go back to your town to see your parents are elderly, if they have not been vaccinated or not been boosted, you have to be careful, because most of us, young ones, probably you're asymptomatic, but you can carry the virus and then you can infect the elderly. And here the self-empowerment, trace, test, then you test yourself. If it's positive, then you report to MySejahtera, isolate yourself if you are positive, isolate for 7 days, then inform MySejahtera team, and then they will call, the robocall will make sure that you are well, complying to the SOP in the isolation, and you seek treatment if symptoms deteriorate. And here is the digitalization. So we also use the IT system now. Fine, you use e-COVID, and then the test is, fine means those are close contact, for example, then you know that you are close contact, so take care of yourself. Then do testing. All the tests will be, you key in the information, you'll go to SIMCA, Sistem Informasi Maklumat Kesihatan Awam, and then the SIMCA will report the cases daily, and we can trace the people that are close to you if you are positive, and then go for the isolation and support. This is where the CAC, COVID Assessment Center, and monitoring system using digital technology to make sure you are well at home when you are isolated. And here, procedure pengurusan kontak rapat. So we realize now that the close contact, you need not to be quarantined, because here, if you have actually received your booster dose, if you are, even you are close contact, now you do not need to quarantine. It's enough if you do the RTK antigen day 1 and day 3. If you have symptoms, then you quarantine for 5 days if you have completed the dose, booster dose. But if you have not completed your booster dose, whether you have symptoms or no symptoms, quarantine for 5 days. And if you are not, you have not completed your vaccination, quarantine in 7 days. In other words, is that you have been boosted. If you have no symptom given and have received your booster dose, no need to quarantine if you are close contact. But if you have symptoms, then quarantine 5 days. Next. Here is the economy. Important, we can't be in a lockdown for years. So if it's a short term, I think if it's 2 weeks, 3 weeks, nobody question if you want to lock down 2 weeks. But then now we are moving to 2 years. So we need to open up our border, we need to open up our economy, and etc. We need to open up all sectors, but we must be prepared. So the tools that we have today, public health measures, number 1. Number 2, testing. That means you have capacity to testing. Number 3, vaccination. Get your booster dose, if possible, for adult. Adolescent and children, no booster dose, but at least primary dose been given. Then we have the treatment. If you're ill, come to the hospital, we got a treatment for you now. And based on the science, so we make decisions based on science, facts, and data. And we also compare other countries, how they do well in terms of learning from UK or Australia, and even in US. You know, what to do, what not to do, what not to repeat the same mistake has been done by other countries. So this is why we have a lag time of 2 months. There's advantage for us to basically learn from other countries. Next. And here, comparison for the travel requirements for selected countries. We can be very strict or we can be less strict. So we are in the middle, because if you want to travel now, the requirement is that, number one, you must have health insurance. Otherwise, you are infected. For example, if you travel to UK, travel to US, you don't have a health insurance, admitted to US hospital, it's going to be very expensive. So make sure you have the health insurance. Coming to our country as well, you must have the health insurance. Second is that COVID-19 test. 48 hours before you fly, make sure that you have the test. If you're positive, you're not supposed to fly. So that is the screening. And you also pay in terms of the test. Those tourists want to come to Malaysia, they already pay for the on-arrival testing. And then you obviously have to apply. And upon arrival, you'll do the testing, COVID-19 testing. And now we are not going to do RT-PCR. We are going to do RTK antigen professional, and not in KLIA, not at the point of entry, because otherwise there will be a congestion at the airport. So we give you 24 hours to go. Tourists coming to Malaysia, for example, 24 hours, they can report to MySejahtera, they can do the test in the hotel or to any clinics. So at least we decongest the KLIA or the point of entry. Otherwise, all the planes comes in and then everybody queue at the airport, there will be a congestion. And last but not least, after arrival, the testing been done, and then you report. And if you're positive, obviously you'll be admitted, but you have the insurance, then the insurance will cover for your admission. For tourists, this is for tourists, and the transportation also will be arranged from airport to the hotel. So ringkasan, this is pengurusan those travel from overseas coming to Malaysia. So the requirement in terms of testing still continue, and in terms of arrival testing continue, and there's no quarantine. So now no quarantine unless you got symptoms, then you do the test. So it's open from 1st of April. You do the test 48 hours before departure. On arrival, do a test. The test not necessary in KLIA. If you want to do KLIA, you can, because there's a private lab in the KLIA, or you go to the hotel, do it in the hotel or in the GP clinics and etc. Within 24 hours, no quarantine. If you got symptoms, then you test yourself. So that is how we're going to open safely. I think the key word here is that opening up safely for our tourism sector. So last but not least is the community empowerment. Again, we need to encourage the community participation, to encourage ownership on health. Health is not only on the shoulder of the Ministry of Health, but each of us have to be responsible to make sure that we comply, to make sure that we encourage people to vaccine, to make sure that we take all the positive tests to avoid, in terms of the complication, etc. So with that, ladies and gentlemen, I thank you for your attention. And if there's any questions, I'm more than happy to answer.
Thank you very much, Tan Sri, for such a comprehensive landscape review of how COVID emerged in Malaysia and how our health system respond resiliently and improve over the time. And now we are transiting through the endemic phase. Without further ado, we would like to proceed to the Q&A sessions. And our friends and visitors online, you can post your questions onto the online platform. And for our guests in the hall, please raise your hand if you have any question to ask. Just give us a moment, we would like to arrange the stage. We shall start our Q&A session from our guests in the hall. Any question for Tan Sri? I would like to, oh yes, Dato', yeah. Dato' Shah.
There's a burning question from the very beginning.
Can you mention your name first?
Dr. P.P. Shah from Penang. The burning question actually has been in for a long time, and they always ask, why was ivermectin not used for the treatment? Whereas it has been proved that it did reduce the severity as well as getting the chaps up and about quite well. Just please enlighten us on that.
Thank you very much. So when we look into the data, there's a conflicting evidence and there's no consistency in terms of the data, available data to suggest that ivermectin. And remember when we started, we also used hydrochloroquine and a malaria drug. And we have a clinical trials by WHO, we call it a solidarity trial, and it's proven that hydrochloroquine have no effect at all. And likewise, we use Calestra, there's a lopinavir, ketonavir, the HIV drug, also have no impact in terms of to manage the COVID-19. So last year, even in Parliament, this ivermectin issues was raised, the public raised ivermectin, and I'm actually a board member of a DNDi. In fact, 3 years ago, when we explored new compound of ivermectin, new compound in the DNDi to treat dengue, ivermectin was raised again in terms of the use of ivermectin to manage and treat dengue. Ivermectin is the old drug, is used for a parasitic infection, but there is actually an antiviral effect. We know that. The question is the consistency. To use the antiviral effect, you need a very high dose of ivermectin. And we did a clinical trial for dengue, ivermectin for dengue in Thailand. They did a study. But you need a very high dose and you need close monitoring of the ivermectin dosage because otherwise the complication of diarrhea, renal toxicity and etc. will be there. So they did the trial. Halfway through the trial, they have to abandon because of the high side effect. This is from Thailand. So what we did last year, and then when the pressure for Ministry of Health to use ivermectin, we approved ivermectin for clinical trials, exactly what WHO has highlighted. You can use ivermectin, but on a clinical trial basis. So we started to do the ITAC trial, recruiting a patient from both sides in randomized control study of COVID-19. We have about 500 patients recruited, and then we monitor their progress, the given ivermectin, whether they deteriorate to category 4 and 5 or more severe form of the COVID-19. And initially, a lot of pressure on us. We say that we give, in terms of for clinical trial, those enrolled in clinical trial can use the ivermectin. So now we have completed our clinical trial. In fact, that paper has been published in Journal of American Medicine Association, JAMA Journal, one of the peer-reviewed journal, global peer-reviewed journal, accepted, and it was actually the top reference for ivermectin study. And that study shows that there's no improvement, no whatsoever benefit in terms of to stop the progression to the severe form. That is the sort of conclusion of that paper. We have another clinical trials ongoing under the Institute of Clinical Research looking into ivermectin as prophylaxis, whether we can use it as prophylaxis. Again, this trial has not been concluded yet, so we cannot comment on that. Likewise, last year when in Parliament they were asking us to register ivermectin, but we need evidence. As I said, we follow science, facts and data. So this evidence today, when we published the paper in JAMA, that is actually the journal in America, so not only the issues of ivermectin, but it shows that our clinical trials in Malaysia is able to penetrate international journal, which means the quality and the standard of trial is very high. So when the data have shown clearly that there's no benefit whatsoever. So if you recover, with ivermectin, if you don't take ivermectin, you also will recover. So this is the thing that we have shown and proof in our clinical trials. So we go on that. And today, I think this paper, we call it the ITEC paper, has been the center of referral for the global community using ivermectin in COVID-19.
Thank you for the questions. Hot topics on the plate. Well addressed by Tan Sri. Do we have the next questions? And Tan Sri, just now you have mentioned about now the pandemic has shifted to the pandemic of the unvaccinated. As a community as a whole, how can we all from the public, from different NGOs, from professional society, how can we work together hand in hand with the ministry to actually give a good push so that we can shift the pandemic out of the population?
Yeah, we know that in our country and in other countries, there's anti-vax. So sometimes we are not able to convince the anti-vax. But there's also a large number of people watch and see. And this is a group that I think we can convince. More important, they are worried about the side effect. And we are not saying that vaccine do not have side effect. All the vaccine have side effect. But if you have a side effect, majority of the people that have a FE, adverse events following immunization, they are mild, manageable. Like for example, you got fever, pain on the injection site, and joint pain and etc. For 1 or 2 days, that's mild. You can report it. But if you have a severe form, then you must actually inform us early, and then we'll admit you to the hospital. For example, if you have allergic reaction to the vaccine or some other severe form, then we can manage it early. So all vaccines that we have some form of complication, or side effect, but it's manageable. So we also have reported like myocarditis, inflammation of the heart. 25 cases has been reported, but admitted to our hospital, and we manage them early. So I think the fear is the side effect. But side effect, we have to look into the vaccine in terms of benefit outweigh the risk. So I've shown you the benefit in that sense that, in terms of compared to last year, when in July and August, there's a surge of cases, not enough beds in the hospital, not enough ICU, not enough oxygen, and the fatality rate, death rate daily is about 3 to 4 figures, about less, almost about 500 cases a day. But now, when the Omicron surge, we see that the cases are less now in terms of admission to the hospital and utilization ICU beds. Let's look into the country that actually aiming for 0 cases, like in Hong Kong, in New Zealand. Now, if we were to aim for 0 cases, and our worry is that when the virus managed to penetrate into the country, there will be a tsunami surge. And this is exactly what you see in Hong Kong, because they were aiming for 0 cases control. But when the virus came in, spread like wildfire, because many of them have not been vaccinated, and then the hospital capacity is not there. So this is why we have moved away from 0 cases, but living with the virus. But to live with the virus, you must be vaccinated first, or you have been infected and recovered, then you get natural immunity, and this gives us, in terms of protection. So now that we have actually achieved adult population, 99% already been vaccinated, 3 million people infected with COVID-19 already recovered, which means they have some form of natural immunity, then we are ready to open. So when we open, when you get that infection, then it will be a mild infection or asymptomatic, no symptom. But to avoid to get the infection, we do not encourage to go and get the infection. To protect yourself, still put on the mask, still practice social distancing. Your social and precautionary measures must be in place. Then with that, we can handle. And even if you get infected, we also have the last step, that is actually the antiviral, that is shown to be more effective now. That is the Paxlovid. But Paxlovid also have a complication in that sense that those who want to take Paxlovid, make sure they are not pregnant, make sure that they do not have liver disease, their liver function is good, their kidney function is good, so it's also renal toxicity. You cannot use more than 5 days. It is an oral tablet for 5 days. not more than 5 days. So it's oral tablets. So when you treat, you take the medicine, we must monitor your liver and your kidney as well. So it's not selling the medicine under the counter, in the pharmacy. You can get it from pharmacy, but it must be prescribed by doctors, and then it must be monitored in terms of the safety. Every medicine have a safety issues in terms of side effect, but it must be monitored.
Thanks, Tan Sri. I think it's one of the burning questions that everyone is asking, when can we get the stock of Paxlovid? We do have some questions from our online guests.
Okay, I'm asking on behalf of our online viewers, and this is Imran Hilmi. He's a news reporter from The Star. He has 2 questions, so I'm just going to read it out. The first question is, when Omicron wave expected to end, and what variant of COVID-19 Malaysian could expect in the near future? First question. Second question, is Malaysian healthcare system prepared for the future COVID-19 related pandemic? Thank you.
Thank you very much. Very good question. Now, when will it end? What is certain is uncertain. What is predictable is unpredictable. What we do know is that the virus continues to mutate. It can mutate to be stronger, more virulent, more transmissible. On the other hand, it also can mutate to a weak virus and probably end. Likewise, we have seen before. So Omicron at the moment is that we see from other countries ahead of us, 2 or 3 months ahead of us, like in UK, in Philippines, they have a surge and then the downward trend. So we hope that we will have a downward trend soon. We expect probably end of the March, then there will be a downward trend. We're beginning to see a downward trend, but there is actually a second surge. So the possibility is that Omicron, there are 3 subtypes of Omicron. That means subtype BA1, initially that was the surge. Then there was reported BA2, which is 30 to 40% more transmissible than BA1. And there's also BA3. But all 3 are actually Omicron. So now that we know that there's surge, we hope that there will be a decline in terms of the daily cases and infection. And we are using, because all of us already have immunity, and we hope that the herd immunity approach works. Now, when we started, there are 2 approaches, just as mentioned earlier. We use the prevention and the control approach. That means prevention from getting infection. You stay at home, or you put on a mask, physical distancing. There's a preventive measures, public health measures, comply to all the SOP. Initially, Sweden, for example, and UK, they adopted the herd immunity approach, which means they said, don't need to put on a mask. You can get infected. Once you get infected, then when you recover, you have natural immunity, which is logical. Then that's how you get your natural immunity. But we do not have vaccine then. But you get the natural immunity, and that will be good for the population. But the risk is that the older population, the high risk, the vulnerable population, when they get infected, they will succumb to the illness and probably they die. So that's why you can see earlier in Sweden, the fatality rate is very high. And initially they thought only the older population get infected, but the younger population also get infected and also end up with a fatality. So now I think then they have switched in terms of using public health prevention and control approach. And when we step up the vaccination. So now we have already a vaccination rate about 99% adult, and we also have those recovered 3 million population, then we can use the herd immunity approach for Omicron, because Omicron is still responsive to the current vaccine. Our fear is that if the new variant comes in, it's more virulent, more transmissible, and resistant to the current vaccine. That is our fear. So we need to prepare. But so far, to date, we know that Omicron responds to our vaccine, and that's good. And the vaccination rate is very high. And then we think that we can open up. So we hope that by herd immunity approach, that Omicron will eventually be controlled, and the cases, as you've seen in other countries, are going down. So that's how we will live with the virus, and then in terms of to control the spread and of the Omicron in this country. Now, the caveat now is when we open, there was always one caveat. There is no new variant that is resistant to the vaccine. The new variant that is the more transmissible, new variant that is actually more virulent than Delta. So we hope that we do not have this, not only our country, but the whole world. So then we will know if there is actually a new variant, back to square one, so we need to start our public health measures. But having said that, looking into our experience now, we know the public health measures work. We know that the vaccine works at the moment, and the testing also works. So I think we have enough tool to control the current Omicron. So we hope for the best, and then we must prepare. This Omicron, this COVID-19 pandemic have actually taught us a lot in terms of enhancing our public health measures, in terms of using technology in public health, in terms of increasing our capacity in our hospital. So overnight, you can see our hospital, we can transform some of the wards to become ICU. And then China can build a hospital in 10 days. We, in 3 days, we can build a PKRC to put all our patients there. So we have the experience now to handle in terms of managing. Now we are managing 500,000 patients, at home in isolation using technology in terms of video conferencing. That means with virtual assessment daily, talking to the patient and etc. Only those deteriorating do you admit them to the hospital or the PKRC. So I think the experience that we have prepare us to make our system, our healthcare system, more robust. More importantly, that this pandemic also have actually, brought us together. Public sector and private sector work together as a team. During the pandemic, we have more than 1,000 people, staff from the private sector, nurses, retired nurses, especially 60 specialists from private hospital comes to the Ministry of Health, work with us pro bono in terms of working together with us. And we also use a private hospital to send our patients to the non-COVID cases to the private hospital, and see the working relationship between public and private strengthened because of the pandemic COVID-19. So now we still have the capacity. We are still doing non-COVID cases. Elective surgery is still ongoing in the public sector. We have not referred non-COVID cases to the private hospital as we did in 2021 to make more room to manage COVID patients. So we still have the capacity, but working together, not fighting against each other, working together for a common goal. We have a common enemy here. And this is where if we come together, and that's a good beginning, and then we can actually overcome this pandemic in time to come.
Thank you, Tan Sri. I think we do have some other questions from the online colleagues. Yep.
Yes, online there's another one more from Philip Kaur. This is his question. While mortality is important to consider, COVID can still create severe long-term disabilities. What does Malaysian data tell us about the protective effect of booster doses on long-term disabilities from Omicron, and what is MOH's strategy to deal with the added strain on the public health system from long COVID?
So there are two questions here. Number one is about the long COVID. Number two is in terms of a booster dose. Now, booster dose, at the moment, we only need one booster dose. The question is, do we need another second booster dose, that means the fourth dose or not? At the moment, we do not have enough data to substantiate the use of the fourth dose or the booster dose. But even if we need a booster dose, mainly I think the vulnerable population would be given the priority. For example, those immunocompromised and etc. Why? Because we do not have a perfect vaccine. Perfect vaccine means it's a sterile immunity. Once you get the vaccination, you already have the vaccine forever. And across all mutation, that means it's SARS-CoV-2. That means any mutation, the vaccine works. So we do not have that vaccine yet. And there's no waning of antibody. But unfortunately, we still have waning antibody. What we are doing, the vaccines that we give to the public, we are measuring in terms of the response. Obviously, the antibody works, the vaccine works well after 14 days, and then you'll be peaked in 6 months and some vaccine like Sinovac, 3 months will be peaked, and then it starts to the waning of the antibody. So this is why we are worried the waning of the antibody, especially in the elderly population, they need a booster dose for us to fight with the COVID-19. So I think this is a monitoring process is ongoing, and we hope that in 6 months' time we have enough data for us to substantiate whether we need further vaccination or whether we can have a vaccine for children under 5, for example. At the moment, we follow science, facts, and data. And the next is the question on long COVID. So long COVID is a wide spectrum from the mild symptoms to a very severe form of a long COVID. So we do have cases being reported, and they need to go through, identify the long COVID symptoms, like Malaysia, what they call that, in terms of breathing difficulties and etc. So if you have the mild COVID, we need to monitor closely. It may take 3 months to 6 months for us to manage it well. Whether the question is whether it will be a long-lasting, permanent mild COVID symptoms, it's too early for us to say. But our rehab department, for example, is managing them, and then hopefully that we can improve the symptoms. So for the elderly, we try our best to prevention is better than cure. Rather than once you're infected, then we have to treat. So we try to prevent. If you can prevent the infection, that is the best. Mild COVID is something that we are looking into. It is about 10 to 15% of the patient will have mild COVID. It depends on how do you define the mild COVID, the mild symptom to severe symptoms available. So this is something that we need to look into it. And I think international organizations and countries are also looking to the long-term effect of the mild COVID. Thank you.
Yeah, it's very important for all of us to really remind ourselves, try not to get infected if it's ever possible, get the vaccine. We appreciate the last remarks or questions. If there's none, then I have the last one to conclude the session of Q&A today. Tan Sri, on behalf of the society and the organizer, we would like to ask you to share your thoughts of being the awardee for the inaugural Dr. Wu LienTeh Awards for the leadership in public health, because we think there's no one else deserves this award more than your kind self. So,
I think first and foremost, I'd like to thank the society for giving me this award. But more importantly, it's not about me. It's actually about what we can do to contain or even to end pandemic COVID-19. It's not about the person. It's actually a teamwork in the Ministry of Health. No one person is actually responsible. But more importantly is that the Ministry of Health and everyone in this country comes together as one, and then to fight a common enemy and to end this pandemic together. We cannot end this war without the participation of the public. We can advise the public, but the public has to take their own initiative, empowerment the public in terms of to do what is right to end this war. So I appreciate in terms of the society recognizing the Ministry of Health. It's not me, it is the Ministry of Health that is actually doing the work. So coordination, integration, consolidation, these are all important keywords. Every sector is a health sector. Every ministry is actually a Ministry of Health, because today we see health is wealth, and health affects the economy, the social and everything. So it's about time for us to focus in health, invest in health, so that we got a robust healthcare system that we can move on. Again, I would like to thank the society for the award, but more importantly, it's not me, it is the whole team in the Ministry of Health. And being a DG is not about me and the position. Being a DG is about what we can do to make healthcare better in this country. Thank you.
Thank you so much, Tan Sri, for such a humbling and remarks. It's lovely, touching, and it's such an altruism demonstrated by a healthcare professional and aspirations for all of us. With this, I would like to end the Q&A session. We'll invite Yang Berbahagia Tan Sri to return to the seat. And next, we would like to invite Datuk Sri Anwar Fazal to make a closing remark to conclude today's sessions. Thank you, Datuk Sri.
Thank you so much, Tan Sri. That was just amazing, an amazing presentation. Winston Churchill was once asked to make this kind of closing speech, and it was a time when people had already heard so many speeches, and he said he had in his pocket a short speech and a long speech, and he couldn't decide which one to give. He decided he will do both, and I will also do both. The short speech is thank you, and the long speech is thank you very much. Thank you.
Thank you, Dr. Sri. With this, we conclude today's event. Thank you, ladies and gentlemen, for attending today's session. Please get yourself a copy of free postcard or visit the Dr. Wu LienTeh garden outside. The weather is very nice. It's a blessed day. So with this, thank you everyone for joining us from the virtual platform. We hope to see you soon in our next event. Thank you very much and have a lovely weekend. Thank you.